Hi everyone, it's Dr. Rich from Salvatore Dental. I want to answer some questions today about general dentistry, preventative care, cleanings, how to make sure your mouth is healthy long-term. A question we get is, how often should I visit the dentist for general checkups? So that kind of varies. We have the baseline of usually seeing a patient twice a year, and that's when it's a happy, healthy patient. The mouth is healthy, normal cleanings, not a lot of breakdown going on. Here at Salvatore Dental, the first visit you're going to see with us is very comprehensive. We do a full series of x-rays where there's a lot of tiny little x-rays that go in your mouth so we can see each one of the teeth from all different angles in HD. We look at the bone, we look at the gum, we look at the hard tissue, we look to see if there's any breakdown or decay. We look at all the old restorations and we detect any new issues. We also have the option here of doing a 3D or CBCT x-ray. It's called a cone beam x-ray. Goes around your head and actually creates a 3D model, an x-ray model of your head, and now we can really detect many things that we could not see in the past. And we're excited to bring this to the area. Not many dentists have this technology, but it's great for diagnostics and to really figure out what's going on. We have a lot of patients who come in and they have a tooth up top. It's always been bothering them. It's hard to see with a normal x-ray just because it's near the sinus. Our tooth up top has 3 different roots and it's kind of all compressed together on an x-ray. So with the 3D, we can see everything and we are able to really diagnose much more because of our dental technology. So the frequency that we want to see with normal healthy patients is usually twice a year. At our first visit with a comprehensive exam, we're going to determine exact treatment plan that you're going to need and kind of your overall health and the trajectory of how we're going to get you there if you're not fully healthy. In other cases, if there's some problems with your gum tissue, we see some patients every 3 months, so maybe 4 times a year, and it can really vary. And honestly, it's kind of varies patient to patient, but also time frame to time frame with that patient, depending on how well they're doing at home. So some patients, we start with a 3-month interval, and then we can graduate up to 6 months. But ideally, we do like to see our patients at least twice a year. People ask, what are the benefits of fluoride treatments? I know it's a big thing in the news now about fluoride in our water and how it can be, maybe not so good for us systemically and things like this. The good news is that fluoride is definitely great for your teeth. And here in the office, what we do is do a fluoride varnish. So fluoride varnish goes on your teeth. It's a varnish, so we paint it on and it kind of sticks to your teeth and it's very isolated just to your teeth. So it doesn't go through your whole system. And what's great about fluoride is it actually will deter or push away tooth breakdown. It can do something called remineralization. So what happens with cavities and breakdown in our teeth, when you have bad bacteria in your teeth from either not flossing or brushing properly or just not taking care of things, then this bacteria creates an acid. The acid actually eats away our teeth and creates a cavity. And the step before it's a full cavity or hole, it's called demineralization. So the acid will demineralize, take away the minerals from our teeth and make it more prone to break and fracture and get a cavity. So fluoride can actually, when it's painted on there, remineralize. It can take the calcium and phosphate that we have in our mouth, I know it's nerdy stuff, and it can actually start to rebuild those areas and strengthen them. So fluoride is great because it's a preventative. We love fluoride for younger kids because, as you know, they don't always brush properly or floss properly. They eat a lot of sticky candy, teeth are coming up, erupting, and there's a lot of movement going on. So with kids, we love doing fluoride varnishes. It's isolated on the teeth and it really can prevent a lot of breakdowns. Fluoride is amazing for our older patients who are on a lot of medications. One side effect from medication is dry mouth. So dry mouth is not just annoying, it also stops saliva. And saliva has a lot of calcium and phosphate in it that will help remineralize our teeth. And if there's no saliva, then the issue is that you can get teeth or a cavity breakdown very fast. So we love doing fluoride varnishes on people with dry mouth from medications. It really just helps. And then also patients who just are prone to having cavities. There's people that no matter what they do, it seems like every 6 months there's another spot popping up. I got a cavity here, cavity there. I have friends who are twins. One twin never has any cavities. The other twin has cavities almost every visit. So in that situation, one twin would definitely get fluoride. So how can I protect my teeth from decay? The way that we protect our teeth from decay are 2 different ways. One is our patients doing their diligence at home. We want to make sure that we're brushing twice a day for 2 minutes. I always say put on a timer, put your phone on. 2 minutes is a long time when you're brushing your teeth. Making sure we're using a toothpaste, ideally a fluoride toothpaste is what we recommend here. And we do like having an electric toothbrush. Electric toothbrushes now are very efficient. We make sure we're going all the way around each surface of the teeth. And then what we really need to do, which a lot of patients want to skip over, is the flossing. Proper brushing, we get about 60% of the tooth area. We need flossing to hit the other 40%. So floss goes in between the teeth, and now we can squeegee up and down between our teeth to remove any of the plaque and breakdown, and that's a great way to help prevent decay and over time. Another thing we like to implement is rinsing, so definitely use a mouthwash. A lot of them have alcohol in them or alcohol-free, but they're meant to kill a lot of the bad bacteria. And it's a really good trifecta that we have with the brushing, flossing, and then rinsing. We can also use something like a water pick, which is a good alternative also. Patients who have a lot of bridge work or dental work, sometimes it's difficult to get in between and floss, so water picks are great. We have some at the office. We can always show you how they work. So that's kind of what we're gonna do at home. And then there's also, we wanna partner up with a good dentist. So here at Salvatore Dental, we see our patients on a regular basis. And when you're here for hopefully a regular cleaning, you see our hygienist. They do a more in-depth cleaning. Even with the most diligent brushing and flossing and rinsing, we still get some buildup that we just can't take off. It's called tartar or tartar or calculus. So this tartar or calculus, it's when plaque actually hardens and calcifies, and you can't take it off with a toothbrush or with flossing. You can actually floss over it and you hear some clicking. That is calculus. So here at Salvatore Dental, we use something called an ultrasonic. It's a little tip that goes in, makes kind of a high-pitched noise, and it uses small vibrations to break off all that debris or calculus, making things nice and smooth. We also use rinsing here, some fluoride varnishes, and then we finish up always with polishing with a pumice, which just kind of polishes the teeth, makes them nice and shiny and feeling good. So that's kind of the normal sequence. You want to have some home care and then also coupled with care at a dental office, hopefully here at Salvatore Dental. So what kind of foods or drinks should we stay away from to prevent tooth decay? We kind of all know this one. We want to stay away from a lot of sugary and sticky things. It's very difficult to stay away from sugar these days. I feel like it's in everything, but it really is a big factor in tooth decay. It's not the sugar that actually causes the decay. The sugar feeds bad bacteria in our mouth. That bad bacteria eats the sugar and produces acid that gives us these cavities. So sugar is not great, so I'd definitely limit that. I'd also hate to say that, anything acidic is also not great. Coffee, soda, this kind of thing, very acidic. It's acid, so it will lead to more breakdown as well. Some things we can do to help prevent this, even if we want to have, something sugary or we want to have coffee, which is totally fine. Just always, if you can, drink afterwards, have some kind of water, something to rinse things out, because we just don't want it sitting on your teeth. And the crazy thing too is also frequency. If you're gonna have a dessert, you eat it once and then we're done. You don't want to eat it all the way through the day. The more time we're coating our teeth throughout the day, the worse. So if we're sucking on like a sugary cough drop or candy and it's just in our mouth all day, that's much worse because of the time frequency. So that's something else to pay attention to. Sipping all day long on like an iced tea or something like this is really, really bad. Patients think that tea is healthy for you, which it definitely can be, but if there's sugar in it and we're sipping on all day long, it really can do quite a number on our teeth. Frequency is one thing, and then also just being very aware of what foods to stay away from, or at least to rinse afterwards. We have the concern very often of, why do I need dental x-rays and are they safe? Definitely a big subject. Patients hear x-ray, it sounds kind of scary, it sounds like I'm getting radiation, it sounds like it's unhealthy. It's actually the opposite. So especially now with our digital technology, and here at Salvatore Dental we have the best technology that's available. The one dental x-ray is going to be equivalent of being outside in the sun for 20 minutes. So it's not much radiation we're getting at all. We go outside, we go on a beach vacation, man, that's like you've taken probably 150 dental x-rays in one day. It's really not bad for you. It sounds kind of scary, but what is beneficial about dental x-rays is that we can find things before they become a big problem. A lot of patients come in and we find something and say, well, it doesn't hurt yet. That's great, because if it hurts, it means it's near the nerve and it means it's a big deal. So if you come in because your tooth is hurting, unfortunately, we're past doing easy treatment. We're looking at something like an extraction or a root canal, something that sounds scary and costs a lot of money. Dental x-rays are great because they are safe, and what they do is they make sure that we can offer the correct preventative care for our patients and catching stuff early. Early diagnosis is huge. Another thing, and not to be too heavy on the subject, but here at Salvatore Dental, we have diagnosed numerous patients with oral cancer. We've taken x-rays, we see something that looks a little bit fishy, and then we'll take a 3D x-ray, really find it out, and then we scoot these patients over to a specialist right away. Thankfully, we've had patients who we have found very aggressive cancer, and they have gotten treatment and they are doing great. It could be preventative, meaning just finding a small spot before you got a full big cavity, or it could be as scary as finding something like cancer, because a lot of times they're asymptomatic, you don't feel anything, and we're able to detect it here with dental x-rays. So how often should we get dental x-rays? At Salvatore Dental, the first visit you have with us, you're gonna get a comprehensive exam and a comprehensive x-ray called a full mouth series. So we'll do a full series of x-rays. It's 18 x-rays of each tooth at different angles. We evaluate the tooth, the bone, the gum. And then in some patients, if you're missing teeth or we can't quite see everything with that x-ray, we'll actually also take a 3D x-ray. 3D x-ray is extremely detailed and can show us much more, probably 10 times more than a regular x-ray. So we do that at your first visit. And then depending on the procedure we're doing, sometimes we take checkup x-rays afterwards. Here at Salvatore Dental, we want to make sure that we're doing everything to par. So a lot of times, every time, after we do a crown, we put the crown on, we take an x-ray, make sure everything's perfect. So we do a lot of checkup x-rays to make sure that the work is also up to par. And then regular frequency here is every year you were going to get some kind of checkup x-ray. So we do the full series when you're first here, and then every year we do a series of 4 checkup x-rays. They're called bite wings. The reason why they're called bite wings is you bite on it and it shows in between your teeth where a lot of patients get cavities from not being able to floss or not flossing. And the reason why we take those x-rays is because it's a lot easier for us to see a cavity if it's on the surface of a tooth, but we can't see in between the teeth, so that x-ray helps us with that. So regular frequency is when we first see you, we get a full series, and then every year, and then every 5 years, we're gonna repeat the full series. That way we got all the teeth, all different angles, we can see how we're doing over time and can prevent any kind of big work by seeing it super early. What causes gum disease and how can I prevent it? So gum disease is also called gingivitis. You might hear that funny word once in a while, but gingivitis, itis just means inflammation. Gingivitis is gum, gingiva. So it's inflammation of the gums. What can cause inflammation of the gums? Multiple factors. It can unfortunately be genetic. You might come from a family where there's a lot of gum disease and you kind of just know that there's tooth loss in the family. So if that happens with you, definitely want to be diligent about coming in and getting things evaluated. It can be from, unfortunately, lack of home care, hectic lives, lots of stuff going on. We definitely need to stay up on 2 minutes of brushing in the morning and at night, flossing, etc. If we kind of fall behind on that, then it can lead to gingivitis. Other reasons can be medications we're on, a diet that we have. There's a whole slew of reasons why gingivitis can occur. The weird thing about gum disease or gingivitis is that it doesn't actually hurt. So it's not like you're like, oh, I got gingivitis. It's there. You might see when you're brushing, you might see a little bit of blood. You might taste blood once in a while. You might have a malodor or someone might tell you your breath stinks or something like this. A lot of our patients are surprised because they say, what? I didn't even know I had that, because it doesn't hurt. And the first step is called gingivitis. Another word you might hear is called periodontitis. That's where now, instead of just the gums being inflamed and going away, now the bone is inflamed and going away. So after gum disease, now it's bone disease. And we want to stop that gum disease before it reaches bone disease, because when it's bone disease or periodontitis, that's when the bone goes away, the teeth get loose, and it can lead to tooth loss. So if you have any questions about how we can help you with your oral care or preventative and just making sure your teeth are nice and healthy, please reach out. We'd love to have you here as a patient. We have all different ages of patients, from 1 year old all the way up to 100 years old. So we'd love to meet you. We do a lot of demonstrations with patients, making sure that it's not just here that you have healthy teeth, but you're having all the routine and techniques that you can use at home so you have a nice, healthy smile. So this is Dr. Rich from Salvatore Dental. If you need anything, don't hesitate to reach out. It's 518-899-6068, and it's salvatoredental.com.